Hello, sir. I'm Mary Agnes Siratilia. I'm from VSU.
BSU
And
talaga? Walang
uh,
lugar?
yes, sir. Like, I live inside the campus, sir.
Mm-hmm. Okay. So next, Mr. Sai. How do you call your last name? C or Sai?
Si, sir.
C.
Yes,
Okay.
sir. Si, sir.
You can introduce yourself. Maybe you can open your cameras if kaya.
Yes, sir, ha? Sorry, sir. Yes, sir. Hi, sir. Good afternoon.
Good
I'm Joshua
afternoon.
C. I'm from Tagbilaran City, Bohol.
Layo, Tagbilaran. Okay. So next we have Mr. Kayon
Kayone, sir.
ng Kayone.
I'm Paul Vincent Kayone from Baybay City, Leyte, sir.
Mm-hmm. Bye bye City Leyte. And how about Miss Tikoy?
Um, Hi sir, good afternoon. I apologize po
Good
kay I was
afternoon.
gisabo ko sir pa rush sa Mercury Drug. I am General Sikoy. I am from Biliran sir. Thank you.
Okay, Biliran. So nandyan ka sa Biliran ngayon.
I am currently in Baybay City sir.
Okay. Pinabalik na pala kayo. Okay. How about Miss Bass?
Hi, sir. I'm Kyra Ansi Bas. I'm from Cebu City. Thank you.
Cebu City. Oh. So bakit ka
Yes.
pumunta, nag-aral sa VSU? Bakit, why you choose VSU for your nursing course?
I chose VSU because I'm also interested, ano laging mga schools na outside of my area, like, dili from Cebu ba? Like, since college man. Yeah.
So you are
Thank
now
you.
in
I'm,
andyan
again,
ka na sa
sir?
VSU? Andyan ka na sa VSU ngayon?
I
Or,
know I'm currently here in Cebu.
okay. Okay, how about Miss Buroy?
Hi, sir. Good afternoon. I am Princess Balderoy and I live in Tagbilaran City, Bohol.
Tagbilaran. Okay, I have classmates they're in Tagbila, in Ubay, Alicia, yan. Marami akong classmate dyan. Okay? So, we have Mr. Tupas.
Good afternoon, sir.
Hmm?
I'm Jenny Tupas po from Tacloban.
Tacloban, wari-wari ka pala.
Yes, sir.
Okay? So, thank you. Okay, and next, Miss Gilizon.
Hello, Zon, sir. Hello, everyone. My name is Marielle Luzon, and I'm from Biliran.
Okay, Biliran. Okay, next, Miss Manigke. Mr. Manigke, right? Brother.
Manig ka, sir. Manig ka.
Mm-hmm.
Good afternoon, sir. I'm Markel Manigke. I'm from Cebu as well, sir.
Okay, Cebu. Wow. Then, Miss Oxtero. Ano ba yung, tama ba yung pag-pronounce ng last name
Yes,
mo?
sir. Tama po.
Mm-hmm.
Good evening, sir. I'm Kath Angel
Good afternoon
Oxteron.
pa
I'm from...
tayo. Hindi pa good evening.
Oh! Pa-advance! Good afternoon, sir. I'm Kath Angel Oxteron. I'm from Tagbilaran City, Bohol as well.
Okay. So, I think andito na yung isa, di ba? Yung hindi pumasok. Andito na ba yun?
Yes, sir.
Andito na yun. Okay,
Complete,
so
sir.
magpapakilala din muna ako. So, my name is Mark Angelo Cristino. I am the pioneering batch of VSU Bachelor of Science in Nursing. And classmate ko si Sir Franz Alaninio. Okay, actually classmate ko siya from daycare until college. Okay, ganun ang bonding namin ni Sir Franz niyo from preschool until naging college, classmate kami noon. Okay? So kaya kilala ko siya and kilala din niya ako. Okay? So I think Sir Franz is on study leave, right? Naka-study leave siya. Okay? So, and also, ano pa ba? Hindi natin kailangan ipakilala muna ng todo-todo. Sige. So, I am 20 plus. Kaya nang mag-isip kung ilang taon na po. So, I've started my academic career as clinical instructor when I was 21 years old. Okay? So, bilangin nyo na lang. I am now in the academe for 9 to 10 years. Okay? So, I am part of VSU teaching force last time, maybe around last 2014 until 2016. Okay, so, and I've then nag-resign ako. I went to UP Manila, nag-teach ako doon, tapos going back here in Luzon in Visayas rather, and I am now here in RTRMF College of Nursing. I hope you are familiar with it, the school RTRMF here in Tacloban City. Okay, so I want to help also my alma mater. That's why I what do you call this one? I pumayag ako to handle health assessment or to teach health assessment. Okay, like sa RE, kahit online man lang. Okay, just have a sort of contribution lang siguro and to help the teaching force of VSU College of Nursing kasi alma mater ko naman sila. Okay? So without further ado, so we will start with our discussion for this afternoon. Okay? So our task for this afternoon is all about your health history. Okay? So because this is the essential and the fundamental aspects of health assessment. Okay? Not only the health history, but also the physical examination. But yung pinakauna talaga is yung health history natin. Sige, I will share screen muna yung, ipapakita ko yung isang output ng classmate ninyo. I will share screen. And let's have a sort of discussion in each of the areas doon sa answer niya. Kung ano yung kulang, kung ano yung masasabi nating mali, or maybe tama siya, or nagkamali lang doon sa kanyang pag-state, okay, or pagka-words niya. Okay, so let's let me share screen first. Ayan, kita na ba natin? Okay, sorry Mr. Tupas, ikaw yung sample ko ng output. Okay, so here, this is your biographic data. Okay, but before we tackle about the biographic data, okay, so I want to share with you, diba, you have subjective and objective data. So based on your lecture, ano yung subjective data natin based on your lecture? What is the difference between your subjective and your objective data? Okay, kasi this is part of your health history also. Because you are asking the patient, you're interviewing the patient, you're gathering information. Any volunteer, what is an objective data?
Subjective data sir is the one na gi-verbalize sa patient na siya ang kanang verify sa iyang gibate, while the objective data are the ones na atong ma-observe and also the kanang mga physical examination, laboratory results and such.
Okay, so here, as you acquire the techniques of history taking and physical examination, you should remember the importance between your objective information and your subjective information. Okay, when we say subjective, these are symptoms. Okay, these are symptoms concerned or what the patient tells you, or there is verbalization from the patient or report from the patient. And when we say naman objective, these are signs. Okay? Signs are considered one type of objective information on what you observe, okay, on what you observe as a nurse. Okay? So again, subjective data is more on the verbalization or report from the patient. And for your objective is more on the signs. Meaning to say, you as a healthcare provider or you as a nurse, ano yung na-observe mo? Okay? That is your objective data. And the best example of that is if the patient verbalizes all about pain. Okay. Masakit ang akong tiyan. That's an example of your subjective data as verbalized. Okay, you need to quote unquote with that with as verbalized. Okay, and for the objective data means to see the signs. Okay, ano yung na-observe mo? Okay, number 1, it is the pain score. Okay, pain score. Maybe 0 is no pain, 1 to 4 is mild pain, 5 to 7 is moderate, 8 to 10 is severe. Okay, and you need to take note kung ano answer ng patient, whether it is severe. Okay, kung answer ng patient 7, that is under moderate pain. And also, another thing, aside from that is your objective. Yung signs, another signs of your pain is yung kanyang guarding behavior, for example. Okay, restlessness, there is irritability. Okay, so those are the objective data. Okay, so again, to summarize between the difference between the subjective and objective data is that for subjective data, it is what the patient tells you. Okay, and also the symptoms and the history from chief complaint through your review of systems. Okay, and for the objective data, mean to say what you detect as a nurse or during your examination, okay, or maybe a part of your laboratory information and taste and your test data, okay, and also all the physical examination findings that you have. That is part of your objective data. Okay, so I think it was discussed to you by in the lecture a component of the subject. Na-discuss ba yan ano? Diniscuss yan ni sir at ni ma'am doon sa lecture. Okay? So, let's go over now with the patient profile. Okay. So, name of patient, tama. Okay, admission. Okay. Based on what I've inquired to your subject head or spearhead of the subject is hindi daw or walang sakit yung patient nyo na in-interview, right? It is a normal individual. Tama ba? Hindi siya na-admit. Yung normal na individual, tama ba? Or person? Yung in-interview nyo? Tama ba?
Ang gi-require naman sir kay kanang okay or if wala daw na-admit.
Okay. Kasi it may vary kasi. You can appreciate having or gathering information or health history if the patient was admitted. Okay, so anyway, so let's go over now with the profile. Okay, here the frequency of admission, first time, second time. Okay, and specify the specific time. And the mode of arrival may be via ambulance, maybe a private vehicle, or maybe a taxi, or maybe other mode of transportations. And admitted via wheelchair or ambulatory, okay, and which ward, okay, the hospital ID and case number, if the patient is admitted, then a specific attending physician, then the deaf, or the specific department rather, whether internal medicine, surgical, FAMED, OPTA, okay, the ears, nose, and throat, or the pediatric ward. Okay, so ito yung pinaka-common, okay, na this is part of the biographic data and it is understandable. No need for you or for us to expound this one because ginagamit natin to in our day-to-day life. Okay, but let's go over now with your history. Okay, so prior to have your past health history, ano dapat ang una dyan? Yung present, di ba? Di ba? Yung present history or present health history or present illness. Di ba? Yun ang pinakauna dyan. Okay, hindi nyo nilagay yung present
Taon sa mo din
illness
na.
kasi nga walang sakit yung in-interview nyo.
Ba,
Tama
si
ba
siya
ako?
ma.
Yes, sir.
Tama ba ako?
Yes, sir.
Yes, sir.
Yes. So, yun kasi yung hinahanap ko, bakit walang present illness to? Okay, so nagtanong ako doon sa coordinator nyo. Okay, kasi nga, normal na patient yung in-interview nyo. Hindi kayo nag-interview doon sa patient na naka-admit. Okay. So, let's tackle that present illness. I know it was tackled already to you, but I want to enhance your knowledge all about the present illness. Okay. So, anybody who can share to me what is present illness and what are the components of present illness? Sige daw. Kasi nag-discuss na kayo dyan. So malamang you are familiar with it. Okay. Maganda yung interactive tayo dito sa RLE kasi doon sa lecture, alam ko hindi tayo interactive kasi napakahaba ng lecture hours. Okay, mas maganda dito sa RLE, maging interactive tayo para hindi naman boring. Okay. So with regards to your present illness, okay, so ano yung nakapaloob dyan? Yung present illness natin.
Chief complaint, sir.
Anybody from the group? Yes, Mr. Kayone.
Chief complaint, sir.
The present illness. Magkaiba yung present illness at chief complaint. Mas nauna yung chief complaint compared to your present illness. Right. Meron bang pinagkaiba yung ating chief complaint and present illness? Meron ba? Based on your lecture, anong pinagkaiba nila? Kasi may mention ni Mr. Kayone yung chief complaint.
I think, sir, included yung nabati before the admission.
So, the difference between your chief complaint and present illness is that in your chief complaint, okay, you make every attempt to quote the patient's own words. That is your chief complaint. For example, my stomach hurts and I feel awful. Okay, if patients have no specific complaint, report this reason for visit, such as I have come for my regular checkup or I've been admitted for a thorough evaluation of my heart. That is chief complaint. Okay? Make every attempt to quote the patient's own words. Naintindihan? Pag chief complaint, i-quote mo yung patient's word. For example, my stomach hurts and I feel awful. Quote unquote, as verbalized. Pero kung wala naman siyang complaint, kunyari, pumunta lang siya sa hospital para mag-regular check-up. So, I have come for my regular check-up. That is chief complaint. And also, or maybe, I've been admitted for a thorough evaluation of my heart. Okay? Hindi naman lahat na pumunta sa hospital, merong chief complaint na may masakit sa kanya, or may nangyari, hindi naman lahat. So, a chief complaint may be a report from the patient na meron siyang nararamdaman, or maybe a sort of regular check-up, okay, or etc. etc. Naintindihan natin? Yung chief complaint? Nakuha pa natin yung chief complaint, everyone? Hello?
Yes, sir.
Okay, yun. So, pag sa present illness naman, okay, present illness is a complete, clear, and chronologic description of the problems, prompting the patient's visit. Okay, it includes the onset of the problem, the setting in which the problem develops, and its manifestations, and any treatment na ginawa during the onset of the problem. That's your present illness. Again, chief complaint, okay, you may attempt to quote the patient's own words. But in the present illness, it is a complete, clear, and chronologic description of the problems, prompting the patient's visit, including the onset of the problem, the setting in which it developed, okay, and also the manifestation, okay, ano yung signs and symptoms, and any treatment done, okay, by the patient during the onset of the symptoms or manifestation. Okay? That's the difference between the chief complaint and your present illness. Klarado ba tayo doon? Ang difference ng two? Okay? I think it was discussed already. So, nire-refresh ko lang yung pinagkaiba ng dalawa. Okay? So, another thing, okay, we go deeply to your present illness kasi maraming component na ating present illness. Okay? So, each principal symptoms or a clinical manifestation should be well characterized and should include the 7 attributes of symptoms. Okay, are you familiar with the 7 attributes of the symptoms? Are you familiar? 7 attributes. And what are those attributes of the symptoms? Ha? Ano kaya yun? What are the 7 attributes of the symptoms? Of symptoms, rather.
Cold spa, sir.
Cold spa. Okay. So those are the location, the quality, the quantity or the severity, the timing including the onset, the duration, and the frequency, and also the setting in which the problem occurs. Okay. And the 6th one is factors that have aggravated or relieved the symptoms, and the 7th is the associated manifestations. Okay. Those are the 7 attributes of symptoms. Okay, so it is also important, okay, to query the pertinent positives and pertinent negative drawn from the sections of the review system that are relevant to the chief complaint. So the presence or absence of the additional symptoms help you generate the differential diagnosis, which includes most likely and at times the most serious diagnosis, even if less likely, which could explain the patient's condition. Okay? So, that is part or the first part of your present illness. Okay, ha? Yun ang first part ng present illness natin. Another part of your present illness, which are the other information that is frequently relevant, like the risk factors. Okay, the risk factors. For example, risk factors for coronary artery disease in patients with chest pain, or current medication in patients with syncope. A syncope, or also known as your fainting. A syncope is the medical term and fainting is our layman's term. Okay? And the third one, another component of your present illness is that the present illness should reveal the patient responses to his or her symptoms. Okay? And what effect the illness has had on the patient's life. Okay? You should always remember the data flow is spontaneously from the patient, but the task of the oral and the written organization is yours. Again, I want to highlight this one. Always remember the data flow is spontaneously from the patient. Okay? From the patient, but the task of oral and written organization is yours as the healthcare provider or the nurse that are going to document what the patient has said. Okay? That one. And also another component of your present illness is that patients often have more than one symptom or concern. Okay? If you can observe that one. Okay? Hindi lang, wala pa akong narinig na pasyente na isa lang ang kanyang symptom or concern. Marami siyang sinasabi upon admission. So each symptoms, okay, merits its own paragraph and full description. Again, each symptoms merits its own paragraph and a full description of the problem or from the patient mismo. Okay? And another thing about the present illness is the medication. Okay? Medication. What about that one? So, medication should be noted, including the name, the dose, the route, and the frequency of use. Okay. Sir, bakit kasama yan? Hindi ba doon din sa past medical history? Di ba sinabi ko kanina, okay, any treatment that has been done during the onset of the symptoms, okay, you need to specify what particular medication is that. Okay, you should take note, including the name, the dose, the route, and the frequency of use. Okay? It includes also the list of home remedies or maybe a non-prescribed drugs or maybe a vitamins or herbal supplements, oral contraceptives, or maybe a medicine borrowed from family members or friends. Or maybe ask the patient to bring in all their medications so they can see exactly what they take. Kasi minsan kasi, meron akong tinake, sir, na medication. Hindi ko na maalala. Okay, maybe you can state there also na nag-take siya ng medication but the patient cannot remember exactly what is it. Okay? So, yun. Yun ang part din ng ating present illness. So, another thing, ang dami naman yan, sir, ng present illness o ganun talaga because that is a chronological order of what or about the problem. Okay? So, another thing, the allergies. Okay, kasama din yung allergies natin sa ating present illness. Okay, allergies including the specific reactions to each medication, such as rashes, or maybe the patient is nauseated, yung nasusuka. It must be recorded also, as well as allergies to foods, insects, or environmental factors. Okay, and also as part of this present illness is note the tobacco use, including the type. Okay? Cigarettes are often reported in pack years. Again, cigarettes are often reported in pack years. Kindly highlight that one. Kasi importante yan. Meaning to say, a person who has smoked 1.5 pack a day for 12 years has an 18 pack per year history. Nakuha natin? Again, ulitin ko ha. Kasi sinabi ko kanina, cigarettes are often reported in pack years. Okay, isang pakete ba? Pack years. So, a person who has smoked 1.5 packs a day for 12 years, how many pack per year ang nakukonsume niya? Sige daw. Diba 18? Tama ako? 18 per year. 18 pack per year. Kasi nga, 1.5 pack per day. And you have 365 days for the entire year. Nakuha nyo on how to report that one kung nag-smoke po ang ating pasyente? Nakuha ba natin? Nakuha natin? Hello? O na-overwhelmed kayo? Ano ba yan? Ano?
Libog siya gamay, sir.
Ha? Ano no?
Libog siya gamay, sir.
Ano no?
Libog daw siya gamay, sir.
Libog siya. Okay, so balikan natin. Okay. Again, cigarettes are often reported in pack years. Okay, so a person who has smoked 1.5 pack a day. Okay, 1.5 packs a day for 12 years. Mean to say, 1.5 na pack ng sigarilyo a day. Okay? For 12 years. Okay? So, ilan yung pakete per year? Ilan kaya? So, that's how to count for the report in pack years. Hindi yung per stick Hindi yung per stick kasi ilang years kayo niyan makaka-answer. Okay? Kailangan pack para isahan na. Ha? Naintindihan natin? Pack years. Okay? Ilang pack ng sigarilyo ang nakukonsume ni patient per day. Yan ha, per day. Okay, yan po ang ating itanong sa ating pasyente for your future use. Ilang pack ng sigarilyo per day. Okay, gano'n na lang para mas mabilis. Okay, then i-times mo yan. Okay, kung ilan talaga. Okay? So another thing, aside from your tobacco use, is that alcohol and drug use. Okay, alcohol and drug use should always be investigated, and it is often pertinent to the present illness. Okay, so those are the component of your present illness. Okay, the symptoms per se, the other information, then the patient's response to his or her symptoms and what effect the illness has on the patient, then the full description of the problem, then the medication, the allergies, the tobacco use, and the alcohol and drug use. Yun ang component ng ating present illness. Nakuha ba natin? Nakuha natin? Hello? Baka natulog na tayo dyan kasi holy hour ngayon, alas 3. Diba? Natulog na tayo? Nakuha ba natin?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, let's go naman to our past history. Okay, so balikan natin yung output ninyo. Okay, sinabi dito, past health history. Okay, so based on the yung pagka-present ng past health history is kailangan naka-paragraph form. Right? Naka-paragraph form ba? Kasi meron akong nakikita din sa inyo na merong paragraph form. Tapos meron din iba nga hindi naka-paragraph. Which is which ba talaga yung ating susundin? Ano, Mr. Tupas?
Paragraph.
O, paragraph form po tayo. Okay. So, tama naman yung sinabi mo dyan that in the past history, kasama dyan ang childhood illnesses. Okay, childhood illnesses. Okay? So, pag sinasabi natin childhood illnesses, this includes your measles, or if the patient experiences already measles, rubella, mumps, whooping cough, chickenpox, rheumatic fever, scarlet fever, and polio. Also, you may include also any chronic childhood illness. Okay? So, tama naman yung sinabi niya. Reports of had chickenpox when he was 18 years old. At that time, he stayed at home for 2 weeks at home treatment per doctor's order and did not take any medicine. Okay? And one scar from the chicken pox located at the upper extremity, especially. Okay. And another thing, adult illness. Okay? Hindi lang po childhood illness. Kasama din ang adult illness in your past history. Sir, ano po yung adult illnesses? Okay? So, providing information relative to adult illnesses in each of the 4 areas. Meron tayong 4 na areas all about adult illnesses. First is your medical. Okay? Medical means to say illnesses such as diabetes, hypertension, hepatitis, asthma, your HIV, hospitalizations, the number and gender of sexual partners, and the risk-taking sexual practices. Kasama po yan. And for the surgical naman, we have here the dates, indications, and the type of operations that the patient have undergone. Okay? And another thing, obstetric or gynecological, which is your obstetrical history. Okay, meaning to say obstetrical history, yung nakailang pagbubuntis na ba, ilan yung anak ng ating pasyente, that is more on obstetric history. And also the menstrual history. Okay, when will be the usual period of your patient? Maybe 14 days, 7 days ba, 28 days, depende yan sa report ng ating pasyente. And also methods of contraception. If meron bang ginagamit na contraceptives or family planning method. And also the sexual functioning. Okay? And last na areas ng ating adult illnesses is that psychiatric. Okay? So psychiatric is more on the mental illnesses. Okay? Illnesses and time frame, the diagnosis, the hospitalizations, and the treatment that was made. Okay? Again, the 4 areas of our adult illnesses is medical, surgical, obstetrical, and psychiatric. Okay? So, hindi naman kailangan that you need to state all the four. Okay? It is only for the applicability. Okay? The applicability. Huwag niyong bigyan ng sakit ang pasyente. Okay? Huwag niyong bigyan ng sakit ng pasyente. So those are the components. Okay? Or the four areas of your adult illnesses. Again, you have tackled the child illnesses, adult illnesses. Okay? Let's go naman to the health maintenance. Kasama din sa ating past history ang ating health maintenance. Okay? Sir, ano yung health maintenance natin? Na ano yung health? For a while medyo naglalag yung kuan ko. Ayan. Lalag for a while. Sorry. For a while lang. Kasi naglalag yung laptop. Wait lang ha, wait lang. Nasaan na ba yun? Lalag. Sorry. Sorry for the interruption. Hello, sorry for the interruption. Medyo nag-lag lang yung laptop. Okay, let's continue. Yung sinabi ko kanina is all about health maintenance as part of your past history. Okay? Okay, as part of your history. So, what are the components of this health maintenance? Okay, so it is more on the, or most especially in the immunizations and the screening test. Okay, for immunization, find out whether the patient has received vaccines for tetanus, for example, or pertussis, or diphtheria, polio, measles, rubella, mumps, influenza, varicella, hepatitis B, or maybe an human papilloma virus, or meningococcal disease, and so on and so forth. Okay? And for screening test, okay, You need to review the pap smear if the patient undergone pap smear, stool test like fecalysis, okay, or occult blood, or mga other na mga diagnostic and laboratory test if the patient undergone that one or naka-experience ba siya ng ganyan. And most probably naka-experience din, lalo na pag co-student nyo ang in-interview nyo. Diba? Kasi meron naman tayong annual na fecalysis, urinalysis. Diba? Diba merong ganyan? Every year? Oh. So kasama yan sa ating past history or past health history. Okay? So yun. Okay, balikan natin yung output ni Mr. Tupas. Okay, tama naman yung ginawa niya, pero dapat in paragraph form. Okay, in paragraph form po tayo, hindi nakaganito. Okay, it should be in paragraph form. Ito, highlight ko ha. Ito dapat naka-paragraph form to. Naka-paragraph form to siya. Yan, in paragraph form yan. Okay, tama naman yung data, but the way he construct is doon tayo nagka-problema. Okay, dapat in a paragraph 4. Okay? Okay, for any question so far? Wala pa bang tanong? Any clarifications? Meron bang tanong? Clarifications? Okay, none so far. Okay, let's go over now to the next one. Okay? Ano ba ang next? Environment ba kaagad? Environment ba kaagad? Environment ba kaagad?
Yes, sir.
Okay. So, with regards to your environment, health history, ang sinabi dito, client is currently under modular learning mode. Allotted time for studying is 9. The client's family rents a house. Kasali ba tong environmental health history all about modular learning mode? Kasali ba to?
No, sir.
Oh, hindi, di ba? So, delete yan. Hindi yan kasama. Okay? Delete yan. Delete. Okay? Pero itong the client's family rents a house, okay na to. Kasi more on the environmental field history. Lives in urban locality and the area is known to be flood prone. House is built with strong materials, concrete, and was just newly renovated last year. 1 story of blah, blah, blah. Water source comes from, and how about the neighbor? Kasama din yun, yung neighbor po natin. Kasi they are part of the environment. Maybe the house is yung congested, the spacing of the house. Okay, for example, the spacing may be dikit-dikit or there is distance from one house to another. Okay, so kasama din yun. And how about yung space? Okay, yung floor. Okay, yung floor area. It may be that particular house is appropriate ba to the family na nakatira dyan? Okay, you need to describe also. Okay, i-describe mo rin. Then, also the drinking water, the disposal, okay, the upper, and also the toilet, the type of toilet. So, meron naman ditong nilagay siya. But, yung spacing lang ng house at yung surroundings ang kulang. Kung saan sa malapit sa pabrika, malapit sa sapa, okay, kindly add that one. Understood, everyone? Kindly include that one.
Yes, sir.
Yun ang kulang.
Yes, sir.
Okay? So, let's go naman toward economic status. Okay, economic status, client has all his basic needs met with financial assistance provided by his mother and father's monthly wages. Okay, can you discuss this, Mr. Tupas? Ano timo ko ni Karoy Sigmund? Ay waray ka man at imo karoy sigmon ini. Ini nga diagram. What do you mean by this diagram? Kasi kasi medyo nalilito ako dito. Can you discuss this one? All about economic status?
Sir, ano po sa general ng family?
Ano? Hindi ko masyadong maintindihan yung audio mo kasi merong madaming background. Hello? Nawala ata si Mr. Tupas.
Excuse me, sir. Am I audible?
Daming distraction ata sa kuan niya, sa end niya.
Hello, sir. Excuse me,
Yes,
sir. Am
Mr.
I audible po?
Yes po.
Audible. Ano po, sir? Genogram sa family ng patient.
Ano?
Genogram sa family ng patient.
Genogram of the financial status of the family.
No, sir. The health history of the patient.
Hindi ko maintindihan, medyo choppy kasi.
Health history po ng family ng patient.
Health history ng family ng patient?
Opo, familial illness.
Kasama ba yun sa economic status natin? Is that related to yung economic status? Related ba yun sa economic status natin?
No. Pero, sir, like, sa new form po kay under yung genogram sa economic status.
Kasi yung genogram natin, it is under the family. Kasi when we say genogram, it is more on the heredofamilial disease that pass from generation to generation. That is our genogram. And it is
Yes, sir.
under the family health history.
Oh.
And when we say economic history, what is that?
Pero sir, sa new form po, under siya sa economic status.
Can you discuss that one? Kasi hindi ko mag-grasp yung paano naging part siya ng economic status. Kasi ang alam ko na economic status is more on the cash flow. Okay? The cash flow and also how the patient or how the family per se, okay, yung pag-flow ng yung pera nila or how they live day to day or in a day-to-day basis. Kasi you are maternal and paternal side is yung sakit kasi yung hinighlight mo dito dapat more on the economic. Kung sino ba yung nagtatrabaho, kung sino, whether the mother or the father, tapos binibigyan lang ba or nagbibigay si parents ng support to the children, or maybe there are relatives that supports the family. That is how you do your genogram when it comes to your economic status. Kasi magkaiba yung genogram natin ng family to your graphical representation to your economic status. Nag-grasp nyo yung difference? Hello? Nag-grasp mo yung difference?
Yes, sir. Sorry po, sir.
Sir.
Oo. Yun kasi yung pinagkaiba nila. Economic status is more on the how the patient live. How the patient lives. Kung sino nagsusupport. Okay? Si father, mother ba? Sinusuportahan niya yung kanyang mga anak? Hindi lang ba yung mga anak lang ba niya ang sinusuportahan niya? Maybe they are part of the extended family o merong extended family, sinusuportahan din ng parents niya. Okay? So that's how you flow your representation there. Or maybe hindi lang si parents yung nag-support ng anak, meron din si relative. Okay? Meron din relative. Okay? That's how in your economic status. Hindi yung sakit. I-delete those mga sakit-sakit or heredofamilial disease kasi hindi yan bagay dyan sa economic status. Bagay dyan doon sa family health history yung ating mga illnesses or your heredofamilial illnesses or diseases. Naintindihan?
Yes, sir.
Okay, sige. Okay, let's move forward. Okay. Wait lang ha, parang nalilito ako dito. Nasaan yung, aside from this, meron ka bang family health history? Ano ba yung family health history mo dito? Parang wala akong
Wala,
nakikita.
sir. Nasa yung ano po, sir,
Ha?
yung genogram pack. Wala po, sir. Yung pinunta ko po sa yung
So
genogram
as
sa
part of
economic
this, as
status.
part also of this one, kailangan meron tayong family health history, right everyone? Kung may sakit yung ating patient, di ba? Hindi naman kailangan may sakit siguro. Okay? You should ask the patient and what are the heredofamilial diseases that they have. Okay? You should ask. Kung meron silang mga heredofamilial diseases, so that's the time you will trace kung saan nang galing. May doon pa sa lolo niya, tapos pinasa sa kanyang parents, tapos meron din sa kanya ngayon. Okay, in their generations, or maybe in the third generations. Okay? That's how family history has been. Okay? Or should be, rather. Okay? So, family history is an outline or diagram in which the age and the health or age and the cause of death of each immediate relative, including the parents, the grandparents, the siblings, the children, and the grandchildren. Okay? The review on each of the following conditions and record whether they are present or absent in the family, like hypertension, coronary artery disease, or maybe an elevated cholesterol levels, or nagka-stroke ba yun, or merong diabetes, or merong thyroid abnormal or problem, or maybe there is renal problem, or merong arthritis, tuberculosis, asthma, lung disease, headache, seizure, and so on and so forth. Okay? Depending yan sa report ng ating pasyente kung anong meron doon sa aking sinabi. Okay? And that's the time you will trace or you will do your genogram because you will trace that particular health condition. Naintindihan ba natin? Naintindihan natin. Now you know. Okay? The difference between the economic status in your genogram. Okay? Hope naintindihan natin. Baka oo lang kayo ng oo kasi naantok na kayo. Yes, Miss Tikoy.
Ang akon answer na kung patient na kaniya most of his relatives sir sa iya mama, sa iya papa o iya mga tito. Iya ginya cancer and cause of death is sir gibangungot ba sir? Unsaon na ano na ko niya sir pagbutang nga genogram pag state ba sir?
That particular condition is not a heredofamilial disease.
Ay, okay sir. Sa
When we say
genogram. Okay.
heredofamilial disease is yung conditions or diseases na nangyari na noon tapos nangyari din ngayon. Like hypertension. Okay? Hypertension noon, yung lolo, noong tatay ng parents niya, tapos nagkaroon din yung parents niya, pati ngayong generation, meron din hypertension. That's heredofamilial. Okay? So generation by generation, merong ganyang sakit. Naintindihan natin?
Ay, okay sir. Thank you.
Yun. Kasi sa most likely yung bangungot is part of your pancreatitis. Okay? And that one baga di siya masyadong when we say it scientifically is pancreatitis, but no known evidence that it is more on the bagungot. Okay? So Any more questions? Sige daw, raise your question now. Baka para naman kuan.
Excuse me, sir. So like
Yes.
if dili ang cause of death kay dili siya familial, dili na mo siya ibutang.
Maybe you can put it in the paragraph form in your family health history. Di ba meron yung paragraph form at merong genogram, yung family health history nyo? Okay? So, if hindi siya, or if that particular condition is not a heredofamilial disease, you may state there in the paragraph form. Because we cannot trace that one in the genogram. Kasi nga, yung generation lang niya ang nagkaroon ng ganyan. We cannot say that it is part of the heredofamilial disease kasi nga, hindi nangyari in the past. In the past. Or, yung hindi nangyari from generation to generation. That is heredofamilial. Meaning to say, nandyan sa dugo nila, nanalaytay. Okay? That is heredofamilial. Okay? Maybe you can put lang also into your genogram yung anong particular sakit. Pero hindi siya part heredofamilial. Okay? But most probably hypertension, that is a very common condition. Okay? That passes from generation to generation talaga yan. Okay? So any more question? Nasagot ko ba yung question mo, Miss Doroy?
Yes, sir. Thank you, sir.
Okay. So any more question?
Excuse me, sir.
Yes po, Mr. Manigke.
I'd like to ask, sir, actually, sir, in the format of the health assessment form that was given to us by Ma'am Daiz, we just followed the exact, sequence of the stuff we have to put, sir. So, the placement of the family genogram is awkward, sir, because it's at the end of economic history, but it isn't specifically stated that it has its own section, sir. Instead, I noticed that in the past health history, we were told to check boxes if our relatives also have the same condition, sir. Like the ones stated in the health history. Do we put the genogram there, sir, or do we create a new section for the family health history?
So maybe I will clarify, Ma'am Daiz, all about this economic status on why merong ganito na present sa, yung genogram is present in the economic status. I will clarify na lang siguro, Ma'am Dave. Okay? Oh, nawala si Mr. Manigki. Okay, so maybe I want to clarify also with this. Okay, Mr. Manigki?
Yes, sir. Thank you, sir.
Oo, kasi if we say economic status kasi, it is more on the economic status per se. Yung how they live, sino nagsusupport sa kanila. That is economic status. When we say kasi genogram, it is more on heredofamilial disease. Okay, more on the health aspects yun. Magkaiba ng mundo ang economic and your illnesses and health. Okay? Yun. And next one is that, before we go, meron pang question? Wala na. Wala na?
Sir, kanang pwede na ipungutan na about atong ni Agi nga na topic na to, katong subjective ug objective data. Na ako na confused na may like katong sa objective data, sir, nga ang pain rating scale, objective data, sir.
Yes, it is part of your objective data.
Kanang ask why,
Ang
sir,
rating
kay ngano objective data siya, sir, nga kanang ang patient man mo'y murag iya bitaw nga gi-verbalize kung unsa ra nga number ang kasakitan, like dili man ta ka verify sa through kuan sa ang kasakitan, ang rate dito sa kasakitan,
Because
sir.
you provided a scale. That's why it is an objective. You provided a scale. Because when it's subjective, ang sabi ng pasyente mo is, I feel pain. As healthcare provider, how would you gauge that pain? How will you gauge that pain? Kasi nga, yun yung sinasabi niya. So, there are many scales, di ba? You have your Wong-Bakers, and we have also your your pain score. Okay? So it is part of your objective even though na magtatanong ka sa pasyente. Okay? Meron kasing scale siya na ginagamit. That's the difference. Okay? And it's part of your objective. Kung makascore siya ng 7 or 8.
Okay, Sir Gats. Thank you, sir.
Sige. Sino pa ba ang may tanong? Magtanong na
Sir,
kayo. Yes. Yes, Miss
Tanang
Bas.
MVA, sir, ng motor vehicular accident. Di sa,
Mhm.
like, apil na lang na sa paragraph, sir. Dila na lang sa genogram.
You can put in the paragraph, tapos, ano bang gusto mo? Namatay siya o na-aksidente siya? Ano bang
Namatay
gusto mo?
siya.
O kasi,
Namatay siya, like,
kung sa genogram niya, it is part of the cause of death. Maybe you can put that one in the genogram. Di ba? Yung sinabi ko kanina in the family history. So you will have your outline or diagram of the age, the health, the cause of death, okay, of each immediate relative, including the parents, the grandparents, the siblings, the children, and grandchildren. Understood?
yes, sir. Thank you.
So any more question or a sort of clarification? Meron pa ba? Wala na. So let's move forward to your Gordon's functional health patterns. So I want to clarify also this, Gordon's. When we say Gordon's, what is that? Ha? Ilang functional health patterns meron si Gordon's? Wala,
Alam
nawala na sila.
9? Oo, sure, sir.
Ilan? 11, di ba? 11 functional health patterns. Okay? So, pag sinabi natin Gordon's, typology kasi yon. Typology of health patterns. Yun talaga yung title niyan. Yung typology of functional health patterns. So, pag sinasabing Gordon's, it is more on the verbalization. Pag sinasabi natin Gordon's, it is more on the verbalizations. And ideally pag nag-duty na kayo sa hospital, you will put there, for example, dito tayo. For example, in the health perception and health management pattern, you will put there before admission and during admission. Okay? So ano yung mga health perception or health management pattern before admission, and ano yung mga health perception and health management pattern natin during admission. That's the ideal one. Wait lang mga lobat nata. Wait na baka mag-black out to. Sige. Wait for a while. Okay, so again, dapat nakalagay dyan yung health perception, health management pattern before admission and during admission. Okay? That's for kung mag-duty na kayo. Okay? Yun. Okay? Pag nag-duty na kayo. Okay? So, let's go over with your Gordon's. Okay, for the health perception, health management pattern. So in health perception, health management pattern, it is focused on the perception's perceived level of health and well-being and practices for maintaining health. So it was assessed by questioning about general health and vices of the client by interviewing. So what are the components of this health perception, health management pattern? Ano ang mga components nito? Anybody who can answer me para naman meron tayong interaction? Tama ba yung ginawa ng output? Anybody? Kung tama ba? What are the components of a health perception? Sige daw, kasi nag-discuss na kayo dun sa lecture. Dapat, master nyo na yan. Alam nyo na yan.
Alcohol use or mga tobacco use.
Ano?
Included ang mga health habits.
Mm-hmm.
Medication, sir, self-medications and maintenance medications.
Ano pa? Aside from that,
The health maintenance of the client, sir.
mm-hmm.
How the patient describes health and how they perceive their own health, sir.
Mm-hmm. Okay, that one.
Mental health, sir.
Ano?
Mental health.
Mental health. So in other words, the general. Okay, in general, the health perception, health management pattern. Lahat. Okay, all about na experience ng patient, all about the health perception ng ating patient. Okay, lahat yan. So, kailangan naka-state dyan yung before or during admission if the patient was admitted. Pero kung hindi naman siya na-admit, don't bother. Okay? Yung pag-state ng before admission and during admission. But ideally, again, it is part. Okay? Yung before admission and during admission nyo, part po yan. Okay? And next, for the nutritional or metabolic pattern. Mas maganda kasi if you do this in paragraph form or in sentence form. This one. Yung naka-state dito. Mas maganda yan. Time last taken. Meal taken at. So, kailangan naka-paragraph form to. Ay naka-paragraph form. Naintindihan nyo? Dapat naka-paragraph form.
Ang diya na part, sir, kay nag-ingon sa Ma'am Deb na i-table form daw.
Yung pagka-state lang. Yes, naka-tabular siya, pero yung pagka-state lang.
Okay, sir. Thank you.
Yung pagka-state, mas maganda kasi yun. Kasi, for me not for me. Kasi nursing kasi, we are not bound to have the more on the ganyan-ganyan lang. We are bound to have the thorough assessment. Okay, thorough assessment, yung pa 8:30 a.m. yun. Tapos, maglagay ka ng meal taken at home. So, kailangan detailed yan. Detail. Okay, detailed yan lahat. Kaya naka-paragraph form yan. Okay, so you could state there that usually taken breakfast at 8:30 p.m. or 8:30 a.m. rather, okay, and the components of meals are as follows. Okay, ganyan. So, kailangan naka-paragraph form. Okay, and also for your lunch, okay, so the lunch taken usually 12 noon, okay, and it is usually taken at home, and it composed of 2 cups of rice, chicken, or so on and so forth. Okay, that's how you will have to state there. Naintindihan nyo? Okay, sige. So next, this one, elimination pattern. Ano yung kulang dyan? I have my side notes here that the usual pattern of elimination of the patient, maybe morning or afternoon. Yan ang kulang dyan. Okay? The usual pattern of elimination of the patient. Kailangan i-add yan dyan. How often? Okay, yung elimination pattern ng patient, maybe more on defecation or urination. Okay? And another thing with your activity, let's go now to your activity exercise pattern. Okay? So my side notes here is all about, how about the physical activity? Okay? The physical activity and exercise of the patient. Kasi nilagay mo lang dito more on breakfast, rest. Meron tayong activity and exercise, hindi mo binanggit dito. So where is that physical activity and exercise? How often does your patient do exercise, physical activity or exercise? You should also put there. Okay? And also,
Excuse me, sir.
yes po.
Sa part na sinasabi, moreover, before the pandemic, he actively worked out in his room. Pero lately,
Yes,
hindi na siya
hindi ko
nag-work out.
masyadong naintindihan.
Sir, sa part po na before the pandemic, he actively worked out. Lately, hindi na po due to video games.
Okay. Maybe you can
Or
state
more
there. Mas
specific.
maganda nga yun kasi detailed. You can state there.
Andyan na po, sir.
Physical activity, how often does your patient exercise before pandemic? Tapos ngayong nagka-pandemic, so ganyan yung pagka-state. And also household chores. Household chores. It is part of the activity. Household chores. Okay? Household chores. Ano mga ginagawa ng yung patient? Ano mga particular household chores ang usually na ginagawa niya? Okay? So for the sleeping pattern, okay na yan. Okay, the very comprehensive naman. And your cognitive and personal pattern, may I ask, what do you mean by lethargic? May I ask, what do you mean by lethargic? Why you choose the word lethargic? Mr. Tupas? Or,
Hello, sir.
yes po.
Audible po, sir? Nag-search lang po ako, sir, ng synonyms ng laziness tapos lethargic ko yung lumabas na ginamit po natin.
Ano? Hindi ko maintindihan.
Ginamit ko po yung, nag-search lang po ako ng synonyms ng laziness.
No, lethargic is not laziness. When we say lethargic, kung sa kwan pa, kung sa taong lasing, that is lethargic. Lasing. Okay, that is the very good picture or characteristics of a lethargic person. Yung parang lasing. Okay? That is lethargic. Okay, don't be confused of those words. Okay, ha? Magkaiba yung lethargic, oriented, conscious, and coherent. Magkaiba yun. Okay, conscious yung pasyente, mean to say, napukrathiya or nakadilat ang kanyang mata, is conscious, and after that conscious, kailangan responsive ang patient. Okay, responsive ba siya? Coherent ba siya? Oriented ba siya sa time and place? Okay? At one, cognitive patterns. Ang nilagay mo dito is that the patient is presently in state lethargic. Okay? Nabother lang ako doon sa lethargy. Yun, nabother lang ako doon sa lethargy. Maybe you can choose another term for that. Okay? Or word. Okay, and for the role relationship pattern, okay, with regards to your echo map, do not put only a diagram. Mas maigi nang meron kang explanation in paragraph form all about the role relationship pattern. Okay? So you should always, itong pagkatandaan natin, if you have a diagram, always discuss it. Okay? Have a paragraph form on it. Okay? Kailangan yan. Hindi lang yung diagram na ipipresent mo dyan. Kailangan meron ding narrative form or paragraph form dyan. Okay? And also the legends. Don't forget the legends. Kasi hindi naman maintindihan yan. Ano kaya to? School? Parents? Ano kaya yan? Okay? It should be an informative one. Okay? Plus your narrative one. Okay? Okay. And let's go naman to our sexuality reproductive pattern. Okay. You said here that client is heterosexual, never engaged to any sexual activity. Okay. I have a question. What are the other areas that you can assess in sexuality and reproductive pattern aside from that? Any volunteer? All about sexuality and reproductive patterns. Aside from that, heterosexuality, engage in sexual. Kasi pag sinasabi yung sexuality, sex ka agad. Why mo engagement ka agad sexual activity? Meron pang other dimension of how you understand all about sexuality and reproductive pattern. Sino kaya ang may masishare all about that one? Or what have you learned during your lecture about the components of your sexuality reproductive pattern? Sige daw.
Sir, obstetric history, sir.
Yes, it is part of obstetric history. About the family planning methods or contraceptive methods. Kung meron din. Ano pa? Aside from that.
For girls po, kailang menstruation.
Yes, menstruation. It is part. If babae yung patient mo, ha? Then ano pa?
Sexual history, sir. Of all genders.
O andito na kasi sa kanya, never engage in any sexual activity. Aside from that.
Kuan sir, mga screening nga gi-undergo sa patient like sa breast cancer, sa breast self-examination,
Yun, pap smear, or any other laboratory examinations. Ano pa? Okay? So again, don't limit your assessment. Yan ang palagi kong binabalik-balikan or pinaulit-ulit sa mga students ko. Do not limit your assessment. If it is applicable, you perform it. You do it. Okay? Do not limit. Okay? And let's go naman to your coping stress and tolerance pattern. Okay, I have my side notes also here that kindly mention also who are those people that are considered support system to the patient or any diversional activities that the patient do aside from praying. Diba? Ganyan po pag coping stress tolerance pattern. Mention also those people that are considered support system for our patient? Okay, and what are the other activities? Okay, most especially diversional activities that patient have done to relieve stress or to cope with the stress. Okay? Naintindihan ba natin?
Yes, sir.
And also for your value belief pattern. Okay? So what are the factors or what are the other factors related to value and belief pattern that you can put there? Aside from it is important for him to always be kind and polite. Moreover, she reports to have known beliefs, practices with her family that can interfere in any medical procedure in the hospital. Okay, what other factors related to the value and belief pattern that may contribute in that particular aspects? Okay, so I think that would be all for your health history. Okay? Kasi my task for afternoon or my goal for this afternoon is to have a feedback as well as to discuss what are yung mga kulang na dapat natin i-add. Kasi I've read kung na-observe mo, hindi ako nag-comment na sa iba kasi almost the same yung comment ko. Paulit-ulit na lang. Baka makuan kayo, masumhan ka mo. Okay? So, kaya generalize ko na lang yung comments ko. Yun. Hope that you have take down notes as we go along with our discussion kanina. Nag-take down notes ba tayo?
Yes, sir.
Yes, sir.
Okay, so without any more question, meron ba tayong tanong pa? Meron pa tayong question?
Sir, I have a question about sentence construction, sir.
Mm-hmm.
So what would be the best way to construct, sir? Like, should it be like grammatically correct, jud, sir, nga the patient has, ana, jud, sir, or pwede ra nga
Here is
lives
the
with.
one, ha? Kindly delete the word patient. Okay? Dapat hindi siya paulit-ulit. The patient is, lahat na lang the patient. I-limit the word the patient. Okay? And
Yes, sir. Yes, sir.
and also yung third person natin, yung hear him, you can use that one but not all time or all the time. Okay? And also do not use positive negative sign. It's a no-no for nursing. Positive pain, positive rashes. Okay, do not do that one. Okay, wag kayong maglagay ng ganyan. Okay, because it is a no-no. Okay?
Excuse me, sir.
Yes?
If ever, sir, like, naay kanang sakit mo ang kanang interview and then ay nga present nga gibate like comparison sa katong ani sa Gordon, sir, nga ibutang na mo ay nga kanang before admission o during admission during the like kanang pagput sa
Hospitalization.
kanang inagkuan, sir, inaghimo na mo sa paragraph, sir, among iusa ang before niya iusa ang during.
It should be separated and label it before hospitalization and label then during hospitalization. Okay, that's how.
Sir, thank you.
That one. Okay? Maybe hindi lang nilagay dyan yun kasi hindi naman na-admit yung pasyente nyo. Okay? Kaya hindi kailangan maglagay. But, ideally, okay, if you go, kasi gagamitin nyo yan sa hospital kasi, kaya merong worksheet that is to practice you on how to fill up or how to construct all those components of your Gordons.
Hello,
Okay.
sir.
Yes po, Ms. Tikoy.
May ako question, sir, Ann. Ang akong gibutang, sir, during ba, sir, is it safe to say nga, during the date of assessment, kay since wala man siya, sir, na kuan ba, hospital. Parang, ang gibutang na,
What do you mean?
ang sa iya ba sa example sir sa sleep pattern. Unya ang ako utang upon the date of assessment the patient kuan nagkaadahiyan changes sa iya sleep pattern. Okay la ba sir gamitan na upon the date of assessment? Since
Oo, pwede lang
wala
siya.
man yan. Ay.
Oo,
Okay,
pwede
sir.
lang siya. Tapos, kailangan mo din yung state, yung usual sleeping pattern ng patient.
Yes sir. Ako gusto.
Mhm.
Thank you sir.
Any more question? Before we end, kasi tapos naman na tayo, maybe for the other na mga topics natin, medyo matagal-tagal tayo. Lalo na pag nag-start na tayo sa by system na physical examination. Okay? Ngayon, health history man lang tayo. So, any more question?
Sir,
Yes po.
regarding sa like physical examinations, sir, are there any materials na you want us to like buy, sir? Or like
Your the subject head will be the one to announce that one. I think I have no authority to announce that one. Meron kasing uniformity yan ng mga gamit.
okay, sir, thank you.
Mm-mm. Pinabili na ba kayo ng mga gamit? Your kits? Kasi naka-kuan yan, naka isang kuan yan, isang bag yan. Yung kits nyo. Pinabili na kayo or wala
Pala
pa?
kami sir.
Ha?
Nag-start pala kami pag
Oh.
kuan.
That is your kit. Health kit yan or your assessment kit. Any more question?
Excuse me, sir.
Mhm.
Okay sir, if magtapo nag-practice damo kung silingan ra ang kauban?
Ano?
Like a group? During practice demo, sir, okay if kitay akong kagrupo kay silingan nako, ay neighbor nako, sir. Pwede rami magdungan o kuan during practice demo?
Oo, pwede naman. Mm-mm.
Okay, sir. Thanks.
Mm-mm.
Thank you, sir.
Magkapit-bahay kayo ni Say.
Yes, sir.
Yes, sir.
Bye-bye lang or within the VSU compound?
Tagbilaran City, sir.
Tagbilaran. Hindi pa kayo pumunta doon sa VSU. Andun pa lang kayo sa Tagbilaran.
Yes, sir. Wala pa may labot ang first year ata sa kuan,
Wow.
face-to-face.
So magkapit-bahay pala kayo.
Yes, sir.
So,
Yes, sir.
Kasundo kayong mag-aral sa VSU. Is that a coincidence? Okay. So, ano pa ba? Do you have any further questions? Meron pa ba? Okay, let's have a screenshot first before we end. I-screenshot muna tayo. Kindly open your cameras before we end our session for today. Sige, pag-i-open na lang yung cameras, everyone, para makita naman yung mga faces natin na pang Miss VSU and pang Mr. VSU. Diba? Mm-mm. Yan. So, sige. 1, 2, ano ba? Ayan, naka-open pa yung camera yung iba. Yun. 1, 2, 3. Ayun na. Thank you. Okay, so hope that you have learned something this afternoon. Meron ba tayong nakuha na learnings this afternoon?
Yes, sir.
Yes, sir.
Yes,
Yes, sir.
Yes, sir. Yes, sir.
Okay.
Yes, sir.
So, may I ask also if that's okay with you na ganito yung time natin ng session Saturday kasi ito lang talaga yung free time ko talaga because I am in the hospital for yung mga Monday, Tuesday, Wednesday hospital ako niyan. And Tuesday, Friday, I have my lectures also with other subjects. It will be okay Saturday 3 p.m. onwards. Okay lang ba lahat sa atin yung ating RLE? Every Saturday 3 p.m. onwards. Okay lang ba tayo lahat? Is all amenable for that?
Yes, sir. Okay, sir.
Yes, sir.
Yes, sir.
Okay. Sige. So, yan lang po ang ating schedule. If all throughout the semester. If meron mang changes, magchat-chat na lang ako. Okay? Or iba na ata yung grupo ko? Ay, hindi ko alam. Iba na ata yung grupo. Iba na yung CI nyo next week? Ganun ba? Or all throughout the semester ako yung CI nyo? I don't think so. Hindi ko alam. Meron mang binigay
I think they mentioned si Ma'am Dais, sir, nga rotating ko ang CIs for the group, sir. Sorry, sir.
Every week?
I'm not sure, sir.
Wala bang binigay na rotation plan for the entire semester? Wala pa. Baka ongoing pa siguro. Okay, anyway, I will ask na lang Mang Dave for that. Okay? So, once again, everyone, thank you for listening or joining in our session today, and hope that you have gained something or learned something. At least man lang a sort of a topic. Hindi naman kailangan lahat. Okay? So, thank you everyone, and have a wonderful day ahead kasi meron pang time until night. Okay? And always keep safe. Okay? Goodbye everyone. Goodbye. Thank you.
Thank you,
Goodbye,
sir.
sir.
Thank you, sir.
Thank you, sir.
Bye.
Stay.
Thanks,
Bye,
sir.
sir.
Thank you, sir.